Hello friends, I am Dr. Njweipi Joe Chegou. I am a medical doctor and a GI tract proctology surgeon. Today I bring to you the health tidbits, and our subject of discussion today is the different methods of intermittent fasting. Intermittent fasting simply means the scheduled switching between the time we are eating and the time that we are not eating. We eat when we are hungry. But nowadays, we see that there are many people who would eat and eat even when they are not hungry. Such people, if you tell them that they should skip one meal, they will feel that they will just faint and probably just die. But this is not true, ladies and gentlemen. We know that a healthy individual can stay for 8 to 21 days without eating, and he or she would survive. But today we have people who would eat breakfast, and in between breakfast and lunch, they will eat snacks and drink the sodas. At lunch itself, they will drink sodas. In between lunch and dinner, they will eat snacks and drink sodas. And then, of course, in the evening at dinner, they will also eat and drink sodas. When this happens, the bloodstream becomes overflooded with glucose. And we know that the presence of glucose in the bloodstream is the one that triggers the secretion of insulin. And when insulin is secreted, insulin does three things. The insulin would actually cause the cells of the body to use glucose as a source of energy. And then the second thing is that the same insulin is going to cause the conversion of glucose into glycogen and also into fat, which is stored in the body. Now, when somebody has developed this type of what I would say carbohydrate addiction and eats so many times a day, and the blood is always in an excess of glucose, overflooded with glucose, the system or the pancreas also secretes a lot of this insulin that is corresponding to that amount of glucose. But it comes to a point where the whole system is saturated. The process of the insulin to convert glucose into glycogen or into fat becomes saturated. It does not, that system or that process does not work again. And so what happens is that we have an excess of glucose in our bloodstream, what we call hyperglycemia. And of course, we will also have a corresponding amount of insulin secreted in our system. Now, when you have the saturation of the system like this, then you develop what we call the insulin resistance. And insulin resistance is a condition from where many other diseases are going to develop. You can develop from insulin resistance, you will develop overweight that is going to go right up to obesity. You will develop pre-diabetes, which some people actually have for years. Many people develop pre-diabetes for years without knowing, before they actually go into full-blown type 2 diabetes. You can also develop cardiovascular diseases, high blood pressure, heart disease, stroke, and of course, you can also develop cancer. We know that too much sugar or glucose in the system, in the bloodstream, and even too much insulin in the bloodstream actually nourish the arrival of cancer. So you can develop cancer. You can also develop a depreciation in your cognitive function. Your mental clarity is going to depreciate. When you develop insulin resistance, what is the way to solve the problem? The solution and the natural solution to solving the problem of insulin resistance is to use any of the method of intermittent fasting that I'm going to tell you or to talk about now. We have 7 methods of intermittent fasting. And we'll start the first type of intermittent fasting that we'll do is the 16 on 8 hours intermittent fasting. And when you do this, you have a window of 8 hours that you are not eating, and then, of course, also 16 hours of no fasting, of fasting rather. Now, how do you achieve this practically? The practical way to do that is that you skip your breakfast and then you get your first meal at noon and then your last meal at 8 p.m. And then from 8 p.m. right up to the following day, you don't eat. So you will have 16 hours of fasting. Our next, number 2, is what we call the 18 on 6 hours intermittent fasting. Here you have 6 hours window to eat and then 18 hours of fasting. And practically, how do you achieve this? Again, I will say you skip your breakfast, you get your first meal at lunch or at noon, at noon, and then the last meal at 6 p.m. Excuse me. When you have this, then you are going to have 18 hours starting from 6 p.m. right up to the following to midday the following day that you are not eating. So you have 18 hours of fasting. The third method is what we call the 20 on 4 hours intermittent fasting. And here you have a 4 hours window that you are eating and then a 20 hours period that you are fasting. And to achieve this practically, you skip breakfast, eat your first meal at noon, and then your last meal at 4 p.m. When you do this from 4 p.m. on, you don't eat right up to the following day at midday. Like that, you have 20 hours of fasting. The fourth type of intermittent fasting is what we call OMAD. OMAD means 1 meal a day. It is an abbreviation, 1 meal a day. And when you do this, what it means otherwise is that you also practically you skip breakfast and then at midday you eat. And you can take about 30 minutes or 45 minutes to eat your complete meal. And then after that, you don't eat again. So you have practically 23 hours plus of fasting so that before you come to the following day to eat at the same time. So you have 23 hours of fasting. Our next method is what we call the 24 hours intermittent fasting, or what we call again the eat, stop, eat intermittent fasting. Here you eat today and then the following day you have 24 hours that you are not eating, and then after that you continue for the rest of the week. Then the next one, which is the sixth method, is what we call the alternate day intermittent fasting. And here, for instance, alternate days, that is, if you ate on Monday, you jump Tuesday, and then you eat again on Wednesday, and you jump Thursday, and so on and so forth. And then our last method of intermittent fasting is the 5 on 2 days intermittent fasting, which means otherwise that practically you do fasting for 2 days in a week, and then the 5 remaining days you eat normally. Intermittent fasting, ladies and gentlemen, is good for our health. If you want to stay healthier, you have to do intermittent fasting. You have to avoid getting into insulin resistance. But I will say, for some reason, some people develop conditions, or there are some conditions that intermittent fasting is not allowed. Some people are exempted from intermittent fasting, and such will be the topic of our next video. So, ladies and gentlemen, share this information. Let as many people as possible get the information, and I will advise you to stay safe.